Mwande from TUHEDA, Tanzania UK Healthcare Diaspora Association. And today we have Ms. Vanessa Sizya, who will be introducing herself. We're talking about sickle cell. It's going to be her personal story and the challenge and the struggle that she encountered along the way. So she'll introduce herself, and they're going to give us the chance to tell her story. And if someone have any questions, anything, and advice they have, then can pitch in at the end. Okay? Hello, Vanessa.
Hello, I'm Vanessa. I'm 23 years old, and I wanted to talk about my experience with sickle cell. So what I went through from a young age, from living and being born in Tanzania to moving and now living in England with my parents. So yeah.
Okay. Now, can you tell us a little bit how things were when you were growing up in Tanzania before you came to the UK?
Life in Tanzania when I was born there, it was really difficult in terms of pain. So when I was younger, I used to have a lot of sickle cell crises, and we didn't know at that time that it was sickle cell crises, because every time me and my mum used to go to the hospital to just have checkups to see what's wrong, they would always tell me either it's malaria or that I have sickle cell traits. So then going back, we never really understood why I was suffering like that. But it was only when I moved to England, then it started to make more sense, because I was then going to the hospital, and then we had I had my checkup to sign up with the hospital. That's when the doctors were able to discover that it was sickle cell. So the doctors here in England were even really shook on how I was able to survive for that period of time, because it's really dangerous for sickle cell people to stay without even having any sort of treatment. And I know that different people, different sickle cell types have their treatments in a different way compared to mine. But because with my one, because they also did scans, and that they were able to see that there were some traces of me having strokes back in Tanzania. So I'd previously suffered from 2 minor strokes. And then when I came to England, it's only when I had my 3rd minor stroke that then they decided to change my treatment. So I went on a blood transfusion program. So from there, my sickle cell crisis, they started reducing a lot more, even though when I was younger, I was still suffering from like painful crises once in a while, but they started to improve a lot more the longer I stayed on my treatment. They were also giving me medications like folic acid and penicillin just to control other infections from coming up. So I drank those until the age of 18. So, but now I'm able to control it. So I know how to go about, and they've also changed my treatments, because with blood transfusions, it can get bad in terms of, because you get iron built up from the blood that you receive. So they were trying to reduce the ferritin levels just so my iron levels don't go up and it doesn't cause things such as liver damage. So yeah, now I'm on the blood exchange program, so it's a lot better.
Okay, fantastic. Now, in terms of in your family, I gather you had a brother who had the same problem. Can you tell us a little bit more about him, please?
Yeah, so my older brother, who would have been around 28 right now, he was born in Dar es Salaam as well, Tanzania. But unfortunately, he had sickle cell as well, which they were unable to detect too. So then he got really sick to a point where he got admitted into hospital. So unfortunately, with him, he passed away. But learning my parents from learning from that experience, they were extra scared when it came to me, because they saw me getting sick. My dad was already living in England because he was studying here, but he was what my mom and dad's plan was to come to England and to earn a little bit of money just so they can move back to Tanzania. But seeing the situation with me, they decided that when we came here, when I got my diagnosis, it was best to stay in England just for the sake of me. Even the doctor suggested that we don't recommend you guys going back to Tanzania because it's just dangerous for Vanessa to live there. If she's going to be receiving blood transfusions from in Tanzania, you have to be extra careful because the blood that she may receive, it may be not as good as the one that I'm receiving here, just because there's other things you have to be careful of. So yeah.
All right. And from that experience, what main symptoms has been causing you more problems, and something that you think taking you to visit the doctors more? What sort of? Yeah.
So the main symptoms that I mainly get when I do have my sickle cell crisis is really sharp pains in my stomach. And then after that, I normally get really painful joints. So I'm unable to walk or move whilst being in having abdominal pains. So it's really bad. My mom normally has to take care of me, and I'm not able to do anything by myself, like the simple things like getting changed or even by eating by myself. So it gets really bad when I have my sickle cell crisis. But these days, because I'm a lot more older and the treatment that I get is more stable, I haven't had a crisis for about a year now. So I have like one every year. So, but it's better controlled now that I'm older rather than when I was younger. It was even worse because my mum would have to take a few days off work, or my dad would have to take some days off work. So it would be hard on them as well.
Okay. And with your sickle cell, are there anything in particular that limit your lifestyle or the way you live your life?
For now, well, especially now during Corona, I have to shield, so I'm not able to go out. And when I was younger, I would say it affected me a lot more. So when I used to go to school, I wouldn't be able to do things such as swimming, because if I get a cold, then that leads me to have more sickle cell crisis pains. So it used to be a lot harder on me, and I can't say for now I'm working, I can't do heavy jobs such as jobs that involve heavy lifting, just because it will have a really bad strain on me. So yeah, I have to do jobs where I'm not standing up for a long period of time because I get really tired quickly. So I have to think about those things even when I'm working.
Okay. So that means that you are kind of limited what sort of exercise you can do.
Yeah. So in terms of exercise, I normally just go out on walks. So I don't do things that strain my body, such as heavy lifting weights, or going to the gym that involves running for a long period of time. It's just light walks just to maintain me being healthy and maintain like me from suffering from joint pain. So that helps a lot.
Okay. I know in England you have summertime and you have winter time, and with your situation, I guess winter's much trickier, right?
Yeah.
So do you go out in the winter at all?
I limit how I go out in the winter, so I don't normally like to go out. If I do go out, I normally wear lots of layers just to prevent me from being sick and getting a cold. And especially I have to drink water throughout the winter and the summer, just because when I don't drink, I get dehydrated. And then I think also what helped me a lot when I was living in Dar es Salaam was because I was drinking water every day. So I'm really good at drinking water. So it limited me from, I think, getting sick a lot more than I would have been, even though I did go through what I went through. So yeah.
Okay. And Had your parents had anyone in their family affected by sickle cell apart from your brother? I mean, like their uncles, their aunts, like that.
No, it's just me and my brother. So my mom and my dad are also traits. I have my younger sister, so she was tested when she was younger and she only has traits as well. So yeah, it's only us two that have it.
Okay. And now, drawing from your experience, is there anything, because me being a doctor, I still live in the north of England, and I have not also for all those years I've been practicing, have not come across a sickle cell patient, and so which can be quite tricky. So how do you see things going, and what message you want to convey to either sickle cell sufferers or the healthcare staff as well? So is there
Mhm.
anything, have a specific message to pass on?
Um, yeah, so when I was in Tanzania, I felt it was mainly the lack of healthcare facilities that um made me and my brother to get the misdiagnosis. It wasn't more so the lack of knowledge, even though I feel that if more people would come about and to just bring awareness that there would be that potential of sickle cell getting treated in a proper way in Africa. But in England, I feel that they have the facilities and but what's missing is the lack of awareness. So knowing how to treat a sickle cell patient as an individual rather than just categorizing them as in say when I go to the hospital and I explain my pain, but they're unable to detect what's causing me the pain, even though it's the crisis, they don't know how to treat it, and that could be frustrating and it could be draining mentally. So I feel that so say like for me, um to have someone that is more so understanding and has the capability of also treating you at the same time, it's really important, because when you feel that you're not heard, it sort of limits you from speaking up and telling them what's wrong. And as well, sickle cell, different sickle cell people need to be treated in different ways. So even though I may have blood exchange, another sickle cell patient may just need tablets to help them with their day. But the level of care that they're getting, I think there just needs to be that little bit more understanding, because yeah, I think because it's not something that you come across every day, they don't know how to go about it.
Okay. And do you have, I know some like diabetic people and people with the epilepsy, they carry a special card or a bracelet or something
Mm.
so do you have something like that? Because if you, let's say, maybe London in your neighborhood and you're nearby hospital, they know you, so they have the record there. But if you come up Newcastle way,
Mm.
we know nothing about you. So, and you come in so much pain. So, what make what do you think can make the detection of your problem easy, so you can get the right care wherever you are?
Um, yeah, I think that's a good idea as well. When I was in university, they gave me a bracelet. So just to identify that I am a sickle cell carrier, and that if they see that bracelet, that they know how to treat, they know how to treat me, as in I need to receive like critical care quickly. But if I don't have that bracelet, yeah, I do come across that problem, because even though I had that, there were still problems of detecting on where my records are, who to contact. So yeah, um, I don't have that over here because my doctors do know me and I have walk-in care. So if I go in and I'm sick, they know to treat me automatically, because the doctor that I have, she's known me from a young age. So that's one of the benefits that I have living over here. Yeah.
Okay. And do you have a network of other people who suffer from sickle cell that you are in touch with, and have you heard the challenges, and especially this time of the pandemic?
right now, I don't know any other sickle cell carrier or someone suffering from sickle cell. I used to know someone when I was in university. So they had a club that they made for just sickle cell people. So you go in and you talk with each other. So we kept in touch for during my time in university and a little bit of time afterwards. I also know someone that I didn't grew well, I grew up with as a family friend, but we're not in contact like that. So yeah, I feel that I want to build more of a network with people who do have sickle cell, just so I know what they've been through too.
Okay. So is there anything drawing from your experience? And obviously things could have been done better. And if that early diagnosis to your brother, I mean, he could have been here today. But are there anything that you think will help apart from the awareness? Are there any other thing that you think may be important to we can save more lives? If you that's right. Anything you say for it?
I think definitely there needs to be more things that need to be done, such as more funding put towards knowing more about this disease, just so that we can all receive the right level of care. I think there also needs to be that sort of stigma that needs to be put down with people with sickle cell, and then building up a more safer zone for them to come out and speak openly about the experience of sickle cell. So maybe more communities and maybe more charities need to be built and put in place just for us to have a safe space to speak and to reach out to people that do have sickle cell and reach out to healthcare socials that can help. So yeah.
Okay. And I think as together we are on board, and we'll be very happy to join force with you in creating awareness for sickle cell and some other diseases that need attention and the non-communicable diseases. So I think personally, I totally agree that we need to have more awareness, not just for the healthcare professionals, even in the community, because you find that someone in the remote areas of Tanzania, there may be family losing kids year in, year out, unexplained death. And if people go, oh, just kazi ya Mungu, goes away. So that's it goes away. So we just need to get this message. If we can pass this information, message, share this kind of personal stories to the mass, I think we can help to save more lives and just help people to get diagnosed a bit early. Now, is there anything else you want to add? I think we got a few people in the audience. If anyone wants to join to ask a question, I'll welcome them as well. There's some guys here from Muhimbili, Muhas, but they don't have a mic. So, guys, if you don't have a mic, you can just type your question. I can pass it to Vanessa. So it's okay. Now, Dr. Mlawa, do you have any question, anything to add? I can see Dr. Mlawa in the corner. He's still at work.
No, I think what Vanessa has told us is very powerful in terms of sharing patient experience. And as a physician or healthcare professionals, sometimes we don't realize how we fail our patient in terms of providing them with proper care. So this shared experience, I think it will help others, not only the patients, but also healthcare professionals. And it is a good story to be shared. It will help a lot of us, healthcare professionals likewise, as well as patients. And if we get another slot in the future, I think it will be a good idea to discuss again, and maybe Vanessa will update us with her new network of other people with chronic condition.
Yeah. Thank you. Thank you. Now, Vanessa, so the question, someone asked about what medication, are you on any medications at all?
Yeah, I'm taking Etsy, so that's to lower my ferritin levels. It's steadily going down, so that's a good thing. I take folic acid, penicillin still. I take them once in a while. These days, I don't take them as often. I take also things that help my body. So I drink vitamin D. I also drink moringa, and I drink hibiscus tea. So that helps me maintain and keep at a good health. Yeah.
Okay. And now, if there's someone with sickle cell watching this conversation, what would you like to tell them?
I would like to tell them that just because you have sickle cell, it doesn't mean that it limits your quality of life. Just because you have sickle cell doesn't mean that you can't amount to the things that you set your mind to. So, for example, me, from a young age, just because I suffered from my strokes and I was slow at learning in school, but it didn't stop me from going on to college and going on to university and graduating. So I feel that's something that most sickle cell people, they need to understand, that just because you've been given sickle cell as a diagnosis, it's not a death sentence. So it's just a way of knowing that you're capable enough to amount to anything that you put yourself or put your mind to. So yeah, I feel it's really important for people with sickle cell to remain mentally strong, because it is something that's really difficult to go through. But yeah.
Okay, fantastic. That's a wonderful piece of advice, and I like it. I think that goes to everyone with any chronic condition. That should not limit whatever you want to do and whatever you want to achieve. I think. Thank you very much for that. Let me have a look if there's any more questions. Like some got someone there. Okay, I think someone just saying thank you. That's from iPhone. I don't know who they are, but guys, you're welcome to speak. Mute yourself. You can just ask Vanessa a question directly if you wish. I think we have another 5 minutes before we wind down. So now welcome your questions. Okay. Now, have you got any plans for this awareness, sickle cell awareness campaign? What plans have you got so far? And what sort of assistance will you need from everyone and from some of us here in the UK and from Together? Is there anything you got in mind that you're gonna need help with?
Yeah, I'm currently starting my own sickle cell awareness page on Instagram. So I'm gonna be raising more awareness, and I found a charity in London to donate to. So it's called Sickle Cell Society. So I do textiles, so that's what I graduated from. So I sell on Etsy, but I plan that half of my proceeds that I do make from my textile design stuff, I'm gonna put towards putting it in donating to Sickle Cell Society, as well as aiming to raise more awareness in the future. So yeah, my Instagram page, I'm going to be posting more about information of people who suffer with sickle cell, as well as raising more awareness on what people with sickle cell go through mentally. And it's not just a page for people who do suffer with sickle cell. I want to appear out to a wider audience. So for them, I've got people from church who I'm going to be interviewing. I've got my parents who I want to interview as well, just so I can hear their perspective and their story. So having help from you would help me gain more sort of strength in raising awareness about sickle cell. So I think it'll help a lot.
Okay. So I think someone is asking whether is your diagnosis a sickle cell disease or sickle cell trait?
Sickle cell disease.
Okay.
Yeah.
Okay, that answers someone from Muhas's question, and that's hey, finally been okay. We had people say well done. People thanking you for sharing your experience and things like that. And do you have any advice or any call for our colleagues? You know, anyone watching this in Tanzania? Yeah, you can pass the message in Swahili if you want. There's no limit.
Yeah, I would say my advice for people in Tanzania living with sickle cell, try and maintain a healthy lifestyle. So the more you eat clean, and you have to be careful of the foods you eat. So it's very beneficial for you to eat vegetables such as spinach. That's my favorite vegetable because it helps it has folic acid. So it'll help you a lot more. And just staying around family who will help support you. That would be a really good benefit too.
Okay, thank you very much. I'll go back to the question. Okay. So I think unless someone has any other questions, I think we maybe went down in 2 minutes. Gideon, do you have any final words from you? I know you're busy there. I have one more question before I let the Gideon in. I think during the pandemic, I know for you be shielding. That's right.
Yeah.
Okay. Apart from the shielding, is there anything that you did find really, really difficult?
Well, the demand isn't the same because
yeah. So for me, I found it really difficult from not socializing with people the way I used to. I feel that with me as well, I'm the sort of person that likes to get out and be active as much as I can. And lockdown has really restricted me from doing that. So it's been something where I've had to find other ways of keeping my mind busy. So doing more design work, that's my way of just keeping busy. So yeah.
Okay. And I think someone just beat me to it. The question I wanted to ask you next, and someone is asking the same question. Have you had your COVID vaccine?
Yes. Yeah. I've had my COVID. I've had my first COVID vaccine. I had it in, I think, 2 months ago. So my next one is due in April. It was something that, of course, I was a bit at first hesitant on getting it, but then I realized just in order to keep myself safe from receiving or getting the virus, it was really important for me to protect myself in those terms, because I also do get the flu vaccine every year when it comes out. So it's just another way of me adding extra protection. So yeah.
Yeah, well, that's fantastic, because a lot of people, they, with all the misinformation out there, people, they're just not very keen taking. But I think the benefit of having the vaccination in your situation is really, really very high. So I'm so happy and so pleased that you had your jab. And what did you have? What vaccine did you take?
I had the AstraZeneca.
AstraZeneca, okay.
Yeah. And my family, they also had the vaccine. So yeah, so it's
fantastic. Fantastic. And it's so happy. So I was dying to ask that question. So yes, Gideon.
So before I say the final, let me ask one more question as well. So can you tell us, Vanessa, what the effect of COVID-19 with your condition, sickle cell disease? How were you affected, or how is it affecting for the time being?
It's affected me in going to work, of course. I used to work in a store. So I gave up that job just because I feel that to commute every day, I used to take the bus. So it was becoming unsafe for me to take the bus every day and to sort of mix myself with other people. Unfortunately, I let that job go, and then I've been shielding for the meantime. I have had another job offer, but when shielding restrictions start to come down, that's when I'm gonna start. Yeah.
Okay, fantastic. Okay, thank you very much, and thank you everyone for attending today, and thank you very much, Vanessa, for sharing your story. And I think it won't be the last time we're having you in Together Talks. So I think at some point we can organize when lockdown is over, and we can, people can meet in, face to face. We can probably have some more activity to raise awareness. I think this is needed, not just for the UK, but I think because it affects not just people of African descent, because either people in the Mediterranean and some people in India, those people can have sickle cell. So I think it's touching every corner. COVID affects many faces. So I think it's a good start, and thank you very much for sharing your story. And we really, really appreciate it. And thank you everyone for attending. So I'll end our meeting here, and until next time, goodbye everyone.
Bye.
Bye.